Hi everyone, my name is Ben Jones. I am the cluster lead nurse for CGL in Cambridgeshire with Substance Misuse Services. I've been leading on the Buvidal rollout for the last 2 years. Initially started off with a small amount of funding for 20 patients. Completely new to us, we had to write a process and a procedure, etc. from scratch. Initially trialled it out in just our Cambridge site. Purely because we had additional nursing and prescriber capacity in that site. It rolled out really well, so we quickly rolled it out to Huntingdon and Wisbech. Those 20 slots were quickly used up over a period of time, and more recently, thanks to some positive feedback and some sort of good data that we collected, funding was increased to an additional 17 slots, so 37 in total, which are now pretty much full apart from a small number of slots that we have reserved for prison releases on Buvidal. Yeah, so Buvidal is basically buprenorphine in a long-acting depot injection form to treat opioid dependency. Comes in different strengths across weekly and monthly depots, and it is a treatment option for anyone that's in treatment with us, subject to funding. It works well because there's less fear of withdrawal, there's less kind of daily spikes of the active ingredients for someone that takes oral OST on a daily basis. We start people off on a weekly injection and move them across to a monthly injection quite quickly, and the month one will last for a long time. Clinical studies have shown that the buprenorphine is still detectable up to 12 weeks after the most recent injection, but it is designed to be re-administered every 28 days. It's more comfortable, people aren't going to get that kind of daily spike of the medication in their blood plasma and then that kind of rapid daily reduction as the medication wears off in their system, and they can potentially go into withdrawal if they're not on a stable dose. The buprenorphine in the Buvidal removes that, and they just have their medication, and then it's just a gradual decline of the active ingredients in their system, in their body, as it wears off. Clinical benefits, like I say, it's exactly the same medication as buprenorphine, just a different way of administering it. It allows the patient to live their life free of withdrawals and allows them to focus on other aspects of their treatment and recovery. There's less worry and concerns of patients falling off prescriptions, i.e. missing collections, changing collection days, bank holidays, weekends, things like that. Scripts going missing, getting lost, medication getting lost once it's collected. Parents with young children, there's no need to worry about safe storage within the home. The patient have to come to us to have their medication, the Buvidal, administered to them. So it's useful for people who are safeguarding, maybe more complex in their needs in terms of they struggle with the demands of a daily collection, and for people who can sometimes struggle to engage. Out of the initial 20 patients that we first had on Buvidal, so we looked at some data in February of this year, 2024. We had 20 on prescription at that point, and we prescribed Buvidal to 35 individual patients at that point as well. 27 of those 35 had been prescribed Buvidal for a minimum of 6 months. 51% of them had reported a reduction in their illicit drug use during that time. 71% reported a reduction in their injecting use of substances. 44% reported improvements within their physical health. 55% reported improvements in their psychological health, and another 18% reported an increase in the number of their paid working days that they were doing. Also thinking around that, 7 of those 35 patients did not get on with the Buvidal for a variety of reasons, such as not liking the injection, or not engaging and missing Buvidal clinic appointments, and had been transferred back to oral opiate substitute prescribing. Another 13 of those 35 patients, 2 of them were successful completions and discharged from treatments. 5 unfortunately disengaged and dropped out of treatments. 3 were transferred into custody. 1 transferred to another service due to moving out of the area, and 2 are still in treatment but no longer on any prescribed medication and continue to do well. Brilliant. So in theory, any patient engaging with us for opiate substitute treatments can be considered in theory. There is one major contraindication, which is alcohol dependency. So anyone that's drinking alcohol at dependent levels or high use of alcohol, there's more risks involved. So we wouldn't necessarily consider those patients for it. But if it was something they were interested in, we would encourage them to work on the alcohol pathway and then move on to Buvidal once the alcohol is more under control. If people are already on opiate substitute prescribing, so buprenorphine, espinol or methadone, they can be considered. Obviously there's work to be done in terms of comparing their current prescribed use and the equivalent dosages of Buvidal to try and make the transition smooth, comfortable and successful for the patients as well. Quite easy to transfer from espinol and Buvidal. The process is quite straightforward, and the comparing doses are quite easy to gauge as well. Methadone can be a little bit more tricky, and people may need to reduce their methadone before kind of being considered to switch over. In theory, anyone can be considered for Buvidal treatment. The administration process for Buvidal is very simple and straightforward. It is a subcutaneous injection that goes into the fatty layer of the skin, so very quick and very simple, although some patients can describe minor discomfort for a moment or two immediately after the injection. There's no special considerations or precautions we need to take when administering Buvidal. We normally ask people how they are with needles and injections, just in case people kind of feel they might feel faint, they might collapse, things like that, so we can offer people to sit down or lie down whilst they have the injection, whatever makes them feel comfortable. When someone is being prescribed Buvidal and on that pathway with us, we encourage them to engage in other aspects of treatments as well. Medication, as with all opiate substitute treatments, medication is not a sole treatment, it's a part of the overall treatment. So we continue to encourage patients to engage in the psychosocial interventions, as well as looking at other aspects of need or support within their lives, whether that's something we can support them with or we signpost them elsewhere to partner agencies. So they would see the nurse once a month for their monthly Buvidal injection, and they would continue to engage with their recovery coordinator alongside that on a regular basis as agreed between the patient and the recovery coordinator. And they should also have regular reviews with the prescriber for medical reviews whilst on Buvidal, just how we would for any other patients on opiate substitute treatment. Okay, so if someone was interested in Buvidal but had concerns, there is a good solid pathway for getting people on Buvidal. They would have an initial consultation with the prescriber to discuss the benefits, the pros, the cons of switching from whatever prescription they're on to Buvidal. The prescriber has a checklist that they need to go through and complete with the patients, which would hopefully answer or alleviate any concerns the patient's got. And we also go through a consent form with the patients as well, so we're ensuring that the patient has all the relevant information to make an informed decision. We have information leaflets and literature that we can give to the patient for them to take away and read at their own leisure if they wish to do that. And if we were starting someone on Buvidal that hadn't previously been on buprenorphine, we would also look at doing some baseline blood tests with them as well. So when we started doing off Buvidal, I think the way we did it worked really well. Is we started off small, did a bit of a pilot in one site and reviewed how that went regularly within the clinical team. I think that proved really well because we were able to respond quite quickly to errors that we were making or things that we were getting wrong, and we were able to then incorporate that and amend our pathway to improve it, for the patient's benefit, but also to make sure that clinically it's safe and effective for everyone involved as well. Once we'd, as I said earlier, once we'd got it off running well in Cambridge, we then had a working system that we could emulate and replicate around the county in the other two areas, and that worked well because we had a proven process that had worked well in Cambridge. So for other professionals or other services that are considering prescribing Buvidal, I would kind of say the same. Start off small, look into it first. Camarus, the pharmaceutical company that manufactures Buvidal, are very good. They have reps who are brilliant. They came out and did training with all our clinicians and our teams, and our Buvidal reps always available at the end of the phone for any queries, any concerns, any support that's needed, and any other additional training needs as well. So that's a really, really useful resource. We'd be more than happy to have other professionals come and shadow us, have a look at our pathways, our processes, and see how it works. Quite happy to kind of share our learning and support with other professionals. And just thinking around the overall treatment, having a sort of comprehensive treatment journey or support system for the patient, that's really important. So I think some patients think prescriptions are kind of the be all and end all of some treatments, whereas actually it's, as I said earlier, it's a really small part, a very important part. But all the other sort of wraparound comprehensive support, holistic support for the patients is just as important as well. So the psychosocial work, group work, looking at triggers, maintaining abstinence and avoiding relapse, looking at other concerns the patient may have within their life that we can support with, whether that's around counselling, mental health support, physical health, housing, debt management. If we can't support internally, we would look at outside support and refer to partner agencies that specialise in those areas and can better support the patient than we can. I think there's a bright future for Buvidal. I think there's a definite need for it within services, and it gives patients an alternative treatment option, and a realistic alternative treatment option as well. It can be expensive. It is approximately 2.5 times the cost of traditional OST when you take into account prescriber time, nurse time, doctor's time, pharmacy time. Some costs are offset. There's less costs that we're paying out to the pharmacies for managing consumptions, supervised consumptions and regular dispensing, etc. I think there's a lot of benefits that outweigh that when you look at the feedback and some of the improvements that I've spoken about already in terms of patients' health and what they're reporting in terms of their treatment outcomes as well. So I think it's important to have it on the board as long as it's permitting, etc., and being able to offer it to our patients as a realistic treatment option. Well, I've hoped it's been useful. If you are in treatment with us or are struggling with any substances, please do get in touch, refer yourself. My hope here is to raise awareness and knowledge around Buvidal and that it is a viable treatment option for people within our services. We have to be realistic about it. We do have limited funding for it at the moment, and we are at capacity with a waiting list. But if it is something you were interested in, or you would like to speak to someone about treatment or any support or help, please do get in touch with us. Our phone number here is 0300 555 0101. Our website is www.changegrowlive.com/Cambridgeshire. There's information on there as well, and you can self-refer on the website as well, or you can ring up or just come into any of our offices in Cambridge, Huntingdon and Wisbech. On a final note, we have social media accounts, so make sure to follow us on there, give us a like, and there will be other information shared around Buvidal and any other treatment options or drugs warnings that may be released in the future.